started the timer and here is your question. Okay. So if you have read and understood, considering its surgical pathology station, kindly tell me how would you answer to the patient about the signet cell carcinoma?
Okay. I'm going to explain to the patient that the histology of the sample tissue that we took shows that he has a stomach cancer, and that's his cancer affecting his food and storage. And how this can affect him depends on the extent of the tumor and then the remnant of the stomach.
Okay.
So those are the ways can affect his quality of life. And also depending on the stage, more is on the stomach or the cancer already spread to other glands apart from the spleen. Also, because the spleen is also removed, you may have a reduced risk of reduced ability to organisms.
When considering the carcinoma of stomach, how would you classify them?
The cancer of the stomach, most common is usually the eye carcinoma, can also be a squamous cell carcinoma. And then there can also be lymphoma stomach, and then there can also be gastrointestinal stomach tumors, cancer affecting the stomach also.
Okay, can you please tell me what is the most common type of carcinoma of stomach?
Adenocarcinoma.
Okay, how does it or what is the etiology of it?
What is the
etiology of
okay? The risk
carcinoma
factors
stomach?
for cancer of stomach includes smoking, eating dried, smoked patient Helicobacter pylori infection.
Okay.
Patient previous cancer and then previous cancer stomach surgery before Abrix. Then elderly patient greater than 70 years. Then may patients that are that belong blood group are also at risk of gastric tumors, cancers.
Can you please tell me if there is involvement of any genes with the association of stomach carcinoma?
Involvement of genes. Yes, the genes involved are the K-reins, the P57, P53.
What does this gene does or how it affects?
Okay.
What's the function of this gene? Yes.
The tumor suppressor genes and then the proto-oncogenes.
Yes. What does it do?
Okay, so the tumor suppressor genes prevent development of tumors in the cells, while a proto-oncogene are normal genes in the body that are divisions. But when they undergo mutations, they become oncogenes, and oncogenes that favor abnormal proliferation of cells that can lead to cancers.
Can you tell me how would you confirm your diagnosis? This report says signet cell carcinoma. How dangerous could that, or what could be the consequences of this report for the patient?
the consequences of the report for the patient is the patient has cancer, so has to undergo surgery, and I'll be interested in the margin of the histology, whether the tumor has been completely removed or not, and if there's also involvement of the lymph nodes involvement, the adjoining lymph nodes involvement. So the extent of the tumor and then the remnant of the stoma that is left after resection could affect the tumor.
Can you tell me the pathogenesis of stomach carcinoma?
Yes, the pathogenesis, there is a hyperplasia in the stomach cells that can lead to intestinal metaplasia in the epithelial, and then this will lead to dysplasia in the stomach. Following the dysplasia, there will be intramucosal carcinoma that will then lead to invasive carcinoma of the stomach.
Okay, sometimes carcinoma of the stomach presents with paraneoplastic conditions. Can you name few which are associated with it?
Yes, it presents with acanthosis nigricans,
Yeah.
and then dermatomyositis.
Yes.
Then can also present with hyperglycemia.
Okay, can you please tell me Borman's classification system of gastric carcinoma?
Yes, the Bowman's classification and it could be fungative or
Yes, fungative,
ulcerative.
polypoid lesion, and
Ulcerative.
ulcerated with infiltrated margins and
And
linitis
then
plastica,
linitis plastica.
and well circumscribed polypoid lesion. Okay, another name for this classification is macroscopic appearance. Can you tell me histological classification of gastric carcinoma, please?
It can either be diffuse carcinoma or intestinal adenocarcinoma.
Okay.
Then,
what about early and advanced?
Then for early gastric cancer is when there is involvement of the mucosa and the submucosa. When it is advanced is when there is involvement of the muscularis layer and then the serosa affectation of this.
Okay, can you please tell me the treatment of, all right, you've diagnosed and now you want to manage the patient. What are the treatment alternatives that can be offered to the patient?
The treatment alternative includes gastric resection,
Yes.
use of chemotherapy.
Yes.
And for some patients may also benefit from immunotherapy, and then radiotherapy may be used for
okay. Can you please name few complications of total gastrectomy?
Patient who have dumping syndrome, which we die.
If you can classify in early complications and late complications, please.
Recurrence malignancy because of the previous gastric cancers.
Yes.
Then
can you define dumping syndrome?
Yes, the dumping syndrome can be early or late. The early dumping syndrome is usually due to hyperosmolalactic content emptying into the small bowel. Though this will lead to accumulation of fluid by osmosis into the gastric intestine. The patient will present with diarrhea and then hypoglycemia because of loss of fluid from the body, and that's the way patients will present in early. For late, usually occur between 2 to 4 hours after eating, and because of large volume of fluid dumped into the the patient have hyperglycemia, then there is insulinemia.
Can you please help me and read this image? What do you see? Can you read this, please?
Yes, there is a multiple.
Okay.
cells that have large nuclei to cytoplasmic ratio, which is in keeping with mitotic lesions.
Okay.
And the cells are numerous.
What is the shape of the cells? Are they all,
The cells,
alike?
no, they are not alike. There are some that have like singlet
Yeah.
shaped.
And some are elongated, some
Related.
are rounded.
Round.
Yes. And what is the stain which has been used?
Eosin stain.
Can be, yes.
It,
And how would you comment about the nuclei, which you can see here, the black spotted ones? Some of them are merged. Some cells have nuclei disappeared.
ratio is enlarged, which is usually
Yeah.
occurs in cancer.
Good. Thank you.